Welcome to the Weekly Literature. Dr. Keith here. Today we're going to talk about a condition called trigeminal neuralgia. And hopefully you've seen the testimonial that we did with a patient in our office a few months ago. It's a video testimonial, so you can just look it up on YouTube, Facebook, all our stuff. But trigeminal neuralgia is basically very intense facial pain. And it just kind of usually just pops up with people. Most of the time they don't really know how it started. It usually gets really intense really quick, and most people can't find anything to kind of help relieve it. And it's usually pretty constant, and so it affects basically their lives. It's like having a really bad headache basically all the time, but it's actually concentrated more on your face. In the case study we're going to go over today, this patient was experiencing that, and she tried all kinds of other things, and she finally went to a chiropractor after trying all kinds of other things. And as you know, we should probably do it the complete opposite way. We should probably go to a chiropractor first, and then if that doesn't help, maybe we can have some other interventions as well. But going back to this patient, she tried all other kinds of things, and the next thing was to actually get a hole drilled in her head. Now, thankfully, she didn't go that route. She did go see a chiropractor. She was evaluated, and they found subluxation specifically up in the upper cervical spine. Her course of treatment was 3 times a week for 4 weeks, then 2 times for the following 8, then 1 for the next 40 weeks, then 2 times a month for the next 7 years. And I say this because the thing with trigeminal neuralgia is some people can get it to go away, but then it just randomly comes back. And again, it's just like when it started. Most people don't really understand why, but it comes back just as intense, and it usually doesn't go away. And so it's important to have that consistent care again to make sure that everything is functioning as optimally as it can. And the reason this is so important also is there's another name for this disease. The other name for this disease is actually the suicide disease, because it just drives people, they can't live the life that they want. This particular lady in this study, one of her favorite things to do was to listen to music, and she could not do anything like that at all. And so it's very important that if you know anybody with this condition, that you tell them to go visit a chiropractor to at least get checked to see if that may be contributing to their symptomatology. I'm Dr. Keith Hassinger. Have an amazing week.